Yes. Okay. Awesome. All right. So welcome everybody. I'm Michelle Cody and I have with me today Sarah Garber from Rosalind Franklin University. This is the Telecollaboration track. So welcome. And right now we have a quote from our alumni to reflect on. Our first presentation today in this time slot is utilizing a healthcare team to foster trust through telehealth visits. And this is IPT Team 3, the qualified caregivers.
Utilizing a healthcare team to foster trust through telehealth visits. So in this simulated experience, we used an interdisciplinary healthcare team to provide simulated care for Amanda, a 39-year-old female living in rural Maine suffering from symptoms of long-haul COVID.
We researched health disparities that Amanda and others may face living in a rural area. These health disparities may result from lack of access to healthy food, fewer healthcare workers, less emergency rooms, and limited transportation options.
The interprofessional health emerges and provides a platform for people in different professions to interact and gain experience from each other. The IPT program was presented by dental hygiene, nursing, PT, OT, PA, social work, and medical students. The goal was to develop skills for person-centered care through teamwork and communication. We did talk about telehealth. Telehealth is the use of technology in order to access healthcare information and be able to make appointments and interact with healthcare professionals.
The telehealth visits. Within the initial telehealth appointment, the goal of our healthcare team was to effectively establish a healthcare plan based on the patient's ability, values, and goals. There were several factors which made Amanda's case of long COVID unique and potentially challenging. These included living in a rural area, her reluctance to recruit the help of a healthcare team, and her fears that her symptoms might not be believed. For our initial appointment, the team utilized open-ended questioning and motivational interviewing principles to gain an understanding of Amanda's experience with long COVID up to this point. The motivational interviewing techniques utilized were open-ended questions, affirmations, reflections, summarizations, and listening for the client's values. Through this, we're able to build rapport and establish the patient care goals of wanting more energy, wants to feel good about herself, and wants to have more consistency in her health day to day.
After the telehealth visits, we had a feedback session with our team, facilitators, Amanda and her husband. One aspect that Amanda noticed was that there was a shift in our team dynamic from the first to second simulation, from a more formalized history-taking approach to a more cohesive one. Amanda also mentioned that she was grateful to have the familiar face in all the visits, which was a social worker on our team. Lastly, Amanda and her husband explained how the suggestion of the support Facebook group was beneficial because it gave them a way to find others that are going through similar situations with long-haul COVID.
Overall, participating in IPT was a great learning experience. Some things we've learned as a group was how to implement motivational interviewing, the importance of motivational interviewing, and how to collaborate with other professions and team members. Some things that would have made the experience a little bit better was spending more time outside of these sessions to collaborate and to create a more cohesive plan of care for Amanda that could have been delivered in the first session in order to relieve Amanda's anxiety.
All right. So I will now hand the floor off to Sarah Garber.
Any questions or comments on this fabulous presentation?
If any of you are on this team, feel free to introduce yourselves or give a wave and share your experience.
There you are. I can start off. How did your team or you individually feel about the telehealth experience? How did that change what you did or how you thought about interacting with the patient?
Hello, my name is Amelia. I'm a second year medical student at the College of Medicine, and I can speak to that a little bit. So traditionally, I've always thought of interprofessional work to occur in the hospital setting or in the outpatient setting. But this really opened my eyes to the idea of interprofessional work occurring over telehealth. As we know, so many errors in medicine occur because of communication issues. So with telehealth becoming more popular, especially since the pandemic and us realizing how much that increases access to care for people in rural and underserved areas, that this approach to medicine utilizing telehealth is perhaps like a really effective way to reduce these communication errors and make it so that patients can access all types of health more readily that's most convenient to them.
That's excellent insight. And I think we are becoming, as a community, we're really realizing the power of telehealth in addition to some of the limitations too. There's a question in the chat, and the question comes from Dr. Crampsey, our new award winner. The question is, you mentioned the patient felt a shift in the second session did you as a team feel that there was a shift? Was it intentional, or did it just sort of happen? Did you have an aha moment about the take-home message from this experience?
Hi, I'm Hope Pryor, and I'm a first-year OT student at UNE. I think one of the main differences from our first session to our second session was that we weren't familiar with each other as different professionals. And so sometimes we kind of approached it in a way that seemed to overwhelm Amanda. And since we weren't familiar with each other, we weren't sure how to address that. But by the second session, we had better rapport with each other. So when we sensed that Amanda was getting a little overwhelmed, we were all able to work together to find a solution together. So I think overall, becoming more familiar with each other was super helpful in making Amanda feel more comfortable.
Another really good insight. So is there sort of a take-home message that you would suggest that next sessions IPT teams pay attention to?
Hi, everyone. My name is Jason. I'm a second-year DPT student. And I think to answer that question, I think if we spent more time outside of like the IPT sessions, getting to know each other, learning about each other's professions, and then coming with a more cohesive goal. Because I know in the first session, we didn't really leave her with a plan or like what our plan was with her. But by the end of the second session, we had a more solid plan, and then her anxiety was like basically gone because she was able to live her life the way that she wanted to with that plan.
Excellent. Excellent. Sounds like everyone had a really good experience, grew a lot. Michelle, how are we doing on timing?
Well, I was just going to say we have a little bit less than a minute left. If anyone has any closing thoughts or comments on how you felt it was working with someone in a different or many people in other programs or professions, we just got a couple quick seconds if anyone wants to add that.
This is Kim Fasula. I'm one of the faculty from Rosalind Franklin, and I was a faculty facilitator for this group. So I just wanted to tell you guys how proud I am to see this culminate into a poster, and just to once again comment about the progress that I was able to see from your first session through the end and how you really became a cohesive group. So I just wanted to say good job.
Interdisciplinary team telehealth visit may be even more challenging. Our team reviewed the experience of working with a simulated long-haul COVID patient to create an easy template of do's and don'ts to promote a successful interprofessional telehealth visit.
To introduce ourselves, the members of our interdisciplinary team include Hannah Freeman, student registered nurse, Sarah Haas, student of physical therapy, Keely Hart, student registered dental hygienist, Meredith McHugh, osteopathic medical student, Tally Toomey, occupational therapy student, and we are all students at the University of New England. And lastly, we have George DeRouge, medical student at the Chicago Medical School.
We also wanted to acknowledge that this project was an interprofessional team immersion project, and we also wanted to acknowledge Dr. Rachel Mayer, who was advising us throughout this project, and to Amanda and Mo, who were the community actors who facilitated our learning experience and gave us valuable feedback, and to all of the staff at the Center of Excellence and Collaboration Education at the University of New England, as well as the faculty at Rosalind Franklin University for making this experience possible.
We all worked together as an interprofessional team for this case study pertaining to long COVID through telehealth. Through this process, we reflected on our teamwork and how we could improve to make a better experience for the patient. We met in total 4 times over telehealth. We received feedback based on these sessions in order to develop an easy list of do's and don'ts as a template for future teams to have a more efficient and productive experience.
Our guide is as follows. Use a questionnaire before meeting the patient to gather information. Do ensure privacy. Do know your team and introduce them. You should actively listen. Do make actionable goals that are patient-centered. And also do be flexible. Don't make assumptions. Don't forget bedside manners. Don't forget you are on a team. Don't ask close-ended questions. Don't forget to use the family, and don't be afraid to redirect.
Through the entire immersion experience, we were able to connect our project to and work towards the core competencies of CECE, which are roles and responsibilities, communication, and teamwork. We look forward to answering your questions in further detail and cannot wait to chat with all of you.
All right, great job, everybody. Like I said before, I'm Michelle Cody, and I have with me Sarah Garber from Rosalind Franklin University. So Sarah, take it away.
Thank you, Michelle. Excellent presentation, and I love the telehealth list. I think maybe we could use this in future versions and include it in our orientation for IPT, possibly in the next version. Does anybody have any questions or thoughts? Yes, Dr. Sheldon.
Good afternoon, everyone. Thanks for the presentation. So this is to everyone who presented. What do you see as the future in your respective professions on the utility of telehealth? You know, we've been hearing over the past 2 years lessons learned from our various experiences with the pandemic. You know, much of care was possible because, you know, accelerated use of telehealth, which really hadn't gained a lot of traction across the country, so, you know, so to speak, in some pockets, but, you know, certainly got accelerated during that time frame. Do you re-envision your practice experience, you know, sort of based on what you learned, you know, through this past semester?
I think it does depend which particular specialty that you're in, but obviously for the physician's role, this is not going away anytime soon. We've seen telehealth only expand throughout the pandemic especially, but also you've seen people move to areas of the country where they don't have access to the same amounts of care that you can get in cities and areas where they used to be living before remote work gave them the opportunity to move. Even outside of just medical care from a physician standpoint, two of my colleagues, Sarah and Tali, work in physical therapy and occupational therapy respectively. And I was really impressed with the way that they were able to incorporate their roles into our project with the COVID patient. Maybe they could take it away with that.
Yeah, so I'm Sarah. I'm the physical therapist that Meredith just mentioned. I find it hard just because of how hands-on physical therapy is to envision a world in which we do majority telehealth. I know it was a big thing during the pandemic, and this experience was nice because throughout my time at UNE, I didn't use telehealth with any of my clinical placements. So I think it was a useful skill in that sense. But it was interesting to try and use physical therapy over telehealth just by kind of thinking functionally. And I think Tali was on the same boat of like, functionally, what can we do in the moment that involves our role? And how do we describe that over the screen? Like we did breathing strategies and ways. She was really into dancing with her kids and how to get her back into that, which was kind of unique part of this experience.
Yes, I agree. I'm Tali. I'm the occupational therapy student. It was really interesting to be able to be on this interprofessional team and doing telehealth and just always remembering to like use the strengths that we have and use the resources that we do have. So relying on those like breathing exercises and things that we could just do in the moment with her and using things in her home as well was really helpful during this experience.
It sounds like there was a lot of creativity going on. How do we make use of what we have available and how to use our resources effectively? I think that's really excellent. Sounds like a really telling experience. Does anybody have any questions or thoughts to sum up this excellent presentation?
I can add something that I thought was unique about doing it like through the CECE was the fact that we did record all of our telehealth sessions, and a big chunk of what we did for our poster was reflection on kind of the recordings. Like we went back and watched through and we took the advice that we gave each other and what our paid actors had given us for advice. And that's kind of how we really came up with what our do's and don'ts lists were. And that's something that we wouldn't have gotten if we didn't do a recorded kind of telehealth simulation like this.
Can you remind me, the session I just jumped from, there was at least one of the students from another university, I think in Chicago. In this example, were there students from different universities participating? I mean,
Yeah.
to me, that's also an incredibly unique kind of component to all of this. And again, this idea in the future that you could be collaborating with a practitioner, literally anywhere, in terms of doing what you're doing. So I don't know, it's not lost on me sort of the power of that. And to your point about expertise, perhaps not being prevalent in certain pockets of the country and rural areas where you can tap into a content expert, anywhere in the world, literally, to be part of a care team. So I don't know, again, it sounds, so remind me again where some of the other students are from.
I believe there was a student from Rosalind Franklin, which is just north of Chicago. We had Rosalind Franklin has allopathic medicine, whereas UNE has osteopathic, but everybody seems to work together really well, which is great.
It's awesome.
Yes, and we had students from Rosalind Franklin from other programs too, but I think just from medicine in this program, in this team.
That's correct. And I don't know that George was able to accompany us today. I know he's on clinical rotations and has a pretty heavy schedule right now.
Say hi for us.
Yes. All right, well, on that note, I'm going to pause it here. If you'd like to continue on this telecollaboration track, you're welcome to sit tight and hang with us. And but otherwise, if you'd like to navigate to another room, you're free to do so. So I'll give you a minute to do that. Thank you all, and thank you, IPT team. This was such a great presentation. So I'd like to welcome everybody if you're just joining us on the telecollaboration track. So this next presentation is from our IPT Team 9, the long haul listeners, who are with us today in person or live on the Zoom. And this presentation is called the Multidisciplinary Telehealth Care Approach for Our Patient with Long COVID.
All right, so what we're going to be doing today is presenting on a patient who's been suffering for long COVID for a while. Overall, there were about 9 of us who are representing different professions in healthcare, and we're just going to be talking through our poster here, kind of one box at a time.
Amanda is a 32-year-old woman who suffered from COVID about 11 months ago, and she came into the clinic or for the telehealth with a consistent headache, persistent shortness of breath, and lingering brain fog.
Our approach to the case relied on communication. We met regularly and created a supportive environment to share ideas, questions, and concerns from different profession backgrounds. We utilized a patient-centered approach, letting Amanda's responses and body language dictate the visit while utilizing motivational interviewing skills. We grouped similar professions together during the simulations. Visit 1, we took a history, and visit 2 was follow-up, education, and treatment plan.
So our treatment plan for Amanda is to essentially cover her asthma. We talked about proper inhaler use since she was overusing her inhaler. We did want to cover also her hypertension. She was on lisinopril, so we would switch that to losartan to minimize any of the dry cough that she was experiencing. In addition, we wanted to make sure that her anxiety was covered by initiating venlafaxine, the extended release, as well as her migraine, since that was affecting her quality of life, by initiating Excedrin.
With respect to the obstacles we encountered, Amanda found it difficult to answer our questions and even look at the screen due to her headaches. Between our first and second encounters, her presentation to the ED for her overuse of the albuterol inhaler was a point of discussion. Her husband, Mo, was present for the second encounter and was more disruptive than productive. We had difficulty with dividing the time appropriately between the health professions.
Based off what Bridget said, to resolve all these obstacles we incorporated calming techniques to help ground her so she can continue on with our sessions. We offered her rest from looking at the screen, which she often accepted. We utilized different therapeutic skills to further learn about what was going on, utilizing listening skills and empathy, and the social worker was able to find resources to her to reduce the cost of her treatments.
We learned a lot throughout this experience, specifically that there is immense overlap between professions and each has a unique skill set to offer for each case. It is also important to trust yourself and your colleagues in order to give the patient the best experience and achieve the greatest outcomes. Finally, time is the biggest enemy. Management is a skill, and repeating questions will only contribute to the patient's frustration.
All right, welcome everybody. I'm going to now hand it over to Sarah Garber.
Thank you, Team 9. And I'm a little bit biased because this was my team. You guys did a really great job. It was not an easy facilitation or simulation to do. I can start off with a question unless somebody else has a specific question that they want to go. Let me start out with asking about the telehealth angle of it. How hard was that for you? Was it just jarring? Did it take a while to figure out how to interact with the patient? How was it on your side?
I'm Bridget Kelly. I'm a first-year student here at UNE, medical student, and I've done one simulation before through school of telehealth, but that was one-on-one, so I was the only one in the room. This was a little bit different to adjust to, making sure you don't talk over one of the other students and making sure you don't talk over the patient as well. So it took a little bit for us to get used to, but again, I think the biggest problem we had with telehealth was just the timing aspect.
Yeah, I'm a first-year medical student at Chicago Medical School. My name is Luke. I guess it wasn't too difficult from our end of things, but it was challenging for the patient sometimes because the screen often like aggravated her headaches. So what we kind of did whenever it got too difficult for the patient with respect to that, we just offered her to kind of like turn off her screen or dim the lights or do whatever she had to do to help her from that end of things, which probably wouldn't be a problem if we'd seen the patient in a clinical setting.
Do you feel like there's a future for telehealth or a place for telehealth?
Yeah, I'm Haley. I am a first-year DPT student at UNE, and I honestly I agree with what someone former said in the past presentations. Specifically with PT, it's hard to imagine it ever being like the main way that we approach things, but I cannot imagine telehealth going away now. And I think everybody will just continue to hone in on their skills with it. And I think now that it's being incorporated in education, which I don't know if it was in the past, I think that'll make a big difference because now we're actually getting simulations and being taught kind of how to handle it. So yeah, I don't think it's going anywhere, but I can't imagine it kind of taking over, but I think it will be offered.
I'm sorry, go on. Go ahead, Andrea.
My name is Andrea. I'm a PA student at UNE. Just to add to that, our pharmacists, we had two people from Chicago who were, Rosalind Franklin, who are joining us, and our plan came from the pharmacist. So a huge part of what we did for the patient was in collaboration with someone that we never normally would have worked with. So I know that that was discussed earlier, but it was great to be a part of that.
Thank you. Those are all really good insights. I was just going to add that the first time we did the telehealth IPT to this past version of our telehealth IPT, the students' skills, everybody's skills on Zoom have increased tremendously. So whether you know it or not, a lot of your skills have gotten much, much better and they're much more honed. So any last thoughts to sum up?
All right, it looks like we are wrapping up this presentation. If you'd like to stick around for other telecollaboration track presentations, sit tight and stay with us. Thank you so much for that wonderful presentation. And I agree, Sarah, I think people have really honed in their virtual skills with telehealth. All right, welcome everybody. If you're just joining us, this is the telecollaboration track. I'm Michelle Cody from the CECE office at UNE, and I have with me Sarah Garber from Rosalind Franklin University, who's our all-star facilitator for this track. I'd like to welcome the Interprofessional Team Immersion Team 2, Nothing About Us Without Us. And their presentation is the Client-Centered Care Through a Collaborative Lens to Treat Symptoms of Long-Haul COVID. So here is their video.
Hi, this is Client-Centered Care Through a Collaborative Lens to Treat Symptoms of Long-Haul COVID. I'm Eliza Burwell, Master's of Social Work student.
I'm Kennedy King, Master's of Occupational Therapy student.
Hi, I'm Kelsey Moulton. I'm a Master's of Science and Physician Assistant Studies student.
I'm Zoe Sedaris, and I'm a dental hygiene student.
I'm Brooke Sorbello, and I'm a nursing student.
Prior to this experience, we were given a background of our client. We found out that she was a 39-year-old female, and she was experiencing long haul COVID for 11 days. She was admitted into the ICU and intubated. She had a few symptoms such as fatigue, brain fog, shortness of breath. Her chief complaint was her migraine headaches. And her goal was to return to her job and be a stronger mom to her children. So long haul COVID is defined as any patient who experiences continued symptoms for at least 4 weeks, and currently doctors still are unaware of the cause of this diagnosis.
The professions that were included were allopathic, osteopathic medicine, physician's assistant, pharmacy, social work, nursing, and occupational therapy. And we all collaborated in discussing the medical history, the symptoms of the patient, and just getting her to where she wants to be. And including social work, she connected with resources and formulating the treatment plan for individual counseling. Some disadvantages and advantages of interprofessional teams where there were many different inputs coming from each profession, which had some benefits and drawbacks, as there was a lot of information to go through and there was a limited time to prep together. Some disadvantages of telehealth appointment was difficult to establish rapport with patient, or that not all patients are comfortable using technology. And some advantages of the telehealth appointment are it is COVID safe and it is effective transition of care.
So for our appointments with Amanda, our patient, we had 2 20-minute interviews, and then we would have a break, and then we had another interview after and there was a little debrief in between. So in the end, we decided to care for our patient. We switched her medications, suggested individual counseling using acceptance and commitment therapy, and we also referred her for physical therapy. You can see her vitals that were from her previous in-person appointment that helped us make the decisions that we did. And in our specific plans consisted of choosing propranolol as prophylaxis for her migraines versus using more reactive treatments such as sumatriptan. We discontinued her albuterol as it was no longer effective for her symptoms and would also be further rendered ineffective with the addition of her propranolol due to medication interaction. And we choose ACT over other modalities because of her application for chronic pain and allowing Amanda to focus on living a valued life despite chronic health concerns.
If we were to be doing this again, we would definitely allow more time to meet outside to plan and make sure everyone understood all of the medications that were planned and treatments, as there was confusion that led to a little bit of miscommunication with the patient.
Okay, I'll now hand it over to Sarah Garber.
Thank you so much for that great presentation. It sounds like it was a challenging sim. What was your what would you tell an IPT team in the fall that they should try and work on and be aware of?
I can answer this. Oh, sorry. I think definitely collaborating with the team outside of the IPT appointments. I think that is something that we did not do. And I think that was where we struggled the most because there was a lot of confusion of different things. So I think if we communicated a little bit before the appointments, I think that could have helped us establish exactly what we want to do for the patient rather than trying to figure it out in like the couple minutes we had right before the patient was coming in. And also just understanding and like doing research, I think, on different type of medications, because I think there was some confusion because some people had more knowledge of certain things. So I think just making sure that you have that knowledge, and if you're confused on something, just to write it down and, do your research, on your own type of thing, as well as like communicating with your group. So I don't know if Eliza, if you want to add something else.
No, I think that just about covers it.
Those are really good insights. Did you have a pharmacist on the team? Remind me.
We did have a pharmacist from Rosalind Franklin, and he provided a lot of really great information. And at the same time, some of us are not coming from a super medical background. And so even so, just with the lack of time, I think that was the biggest thing, is not having as much time to clarify some of the intricacies as we might have liked.
Yes, Frank.
Hi. I had the honor of being one of the faculty advisors to this great team too. And it was a challenging set of issues that they had to confront. And you mentioned communication. And my question is, at the end of it, how did you feel about how those communication issues were dealt with as a team?
I think I could best answer this one. So with the situation we had, it was miscommunication on what the medication was and what it was replacing. At the end, we kind of just cut conversation and we were like, hold on, there's miscommunication. And then the pharmacist, Ken, had taken back over and explained everything once more. And I think that second time explaining, he also used less medical jargon, so it made it easier to understand for everyone in the group as well as the patient, which I think made it a lot easier and helped resolve the issue before we had to sign off on the telemedicine.
That is an excellent insight. Not only is it communication, but it's the right kind of communication. Interesting. Okay.
And I also felt the team regrouped very well, because it could have gone a very different way and it didn't. It could have just ended up in mass confusion and it did not. So kudos to you.
Well, great job, everybody. And we'll begin our next presentation. All right, so our final presentation today on the telecollaboration track is interprofessional collaboration and telehealth treatment plan for a long COVID patient. This is IPT Team 4 from 2021, the Empathetic Eagles.
The implementation of telemedicine has risen greatly since the start of the COVID-19 pandemic, which has prompted healthcare professionals to learn to adapt to this new environment, all while treating a new illness. As the pandemic progressed, practitioners began to treat patients with long-haul COVID, or those who've experienced COVID symptoms for more than 4 weeks.
My name is Natalie Caruso, and I'm a second-year medical student from Rosalind Franklin University. Our team participated in the IPTI program in the fall of 2021. The goal of this program was for different health professions to work together in teams to formulate a treatment plan for a patient with long COVID over a telemedicine encounter.
And my name is Bianca Bustamante, and I am a second-year medical student at UNE. Our research objective focuses on whether a patient-centered or problem-focused approach to patient care is more suitable for telehealth platforms. Our patient, Amanda Barry Mantle, is a 39-year-old who presents with long COVID symptoms after her COVID diagnosis in April 2021. Amanda was hospitalized for 11 days, and shortly after discharge, she began experiencing excessive fatigue, cough, brain fog, shortness of breath without exertion, hair loss, and loss of taste and smell. At the time of our visit, her most debilitating symptom was persistent migraine headaches. During our encounter, we found that building rapport with our patient was challenging because it was harder to observe her nonverbal cues. For example, as we gathered Amanda's medical history, we observed discomfort in her body language due to her migraine headache. Our team occupational therapist recommended that she turn off her lights to make her more comfortable, which facilitated more patient engagement.
We learned that a patient-centered approach is the best way to communicate with patients over telemedicine platforms, especially with those with chronic illnesses like COVID, long COVID. By allowing the patient's priorities to guide the discussion, we empower them and make them feel that their needs are being met. By practicing active listening, by summarizing and using open-ended questions, we can better emphasize with the patient and build rapport. It is also important to set the stage for a good telehealth appointment by ensuring that the patient's environment is conducive for the visit. These strategies allow the patient to become more comfortable and more engaged. With the right practice and skills, telemedicine does not have to prevent healthcare professionals from developing a successful patient-provider relationship. Instead, it can be a great tool to provide accessible and convenient healthcare.
All right, I'm going to keep my screen up so you can all grab that attendance link if you'd like, because we welcome you all to fill out this attendance form, which gives us great feedback for this event. And I'd like to now pass it to Sarah Garber from Rosalind Franklin University.
Thank you, Michelle. The link for the attendance is also in the chat, so you can just click on
wonderful.
that and move right over to it if you'd like to.
And I'll stop my sharing so we can look at the people.
Great presentation. Thank you so much. I can start out the questions by, you mentioned how it was important to make the patient comfortable with telehealth. And I know when you have more than one practitioner and more than one person on it, it can be very difficult both for the team and for the patient to deal with that, especially on telehealth. How did you as a team come together to figure out how to present yourselves to the patient?
I can talk about this. So we, in the beginning of each session, well, in the beginning of the first session, we introduced each student. We had them introduce themselves, speak about what program they're in, a little bit about what kind of questions they were going to be asking as well. And then we also did that in the second session as well, just to give the patient a reminder, just in case she didn't remember who we were from the first session. And that was helpful for the patient. So she kind of knew what to expect from each person rather than just getting bombarded with any type of question from any student.
And then to answer the thing about how did we make sure she was comfortable in the setting with all the different providers helping her, it was kind of something we just learned as we were doing it because we didn't realize the effect that it had on the encounter. We started our second encounter with all of the medical students and the physician associate student to gather the medical history. And it was pretty cut and dry, like a lot of repeated questions that we realized that the patient was not really receptive to because, she's here for that one single complaint or the complaint of long COVID. And she has the migraine right now and she's just not comfortable. So our occupational therapist student, which I've never worked with before, he had a really great idea to make the setting for her encounter more comfortable, which would mean turning the lights off. We wouldn't see her, but she was a lot more receptive to the questions that we had.
Also, we had the students who weren't speaking turn their cameras off. So there was less faces at her on her computer, which she seemed to appreciate as well.
So a little bit of trial and error in terms of how to run the telehealth for yourselves. It sounds like you learned a lot as a team. Are there any sort of bottom lines that you would have, suggestions that you might give to the next DIPTY group?
I also think it's important, just like everyone else said, to maybe meet with your group beforehand a few times just to get more comfortable with each other as a team, which would be helpful for when you start to interact with the patient. Also in the future, not just for this program, but I think it would be helpful to have the same members on a interprofessional team so that you're used to each other already, so that when you see multiple patients in the future, you're kind of you have a flow. And I think that would be beneficial for patients as well.
And then I just wanted to add as an aside, I think it is important to know what skills that people have the most of. So letting those members of your team be allocated to those roles so that you're not repeating things and frustrating the patient.
Those are really good insights. And I think it does really take practice to learn how to do those things. I mean, it is a luxury to have a known team, a group of practitioners that you work with all the time. At the same time, if you have 2 or 3 people that you work with consistently, you can more easily, I should say, bring in somebody from the outside, a specialist as needed. So those sound like really good insights that you will take with you and we can pass on to the next teams. So thank you so much for your participation and presentations. Are there any comments for summing up?
I just want to echo your thanks, Sarah. It's been great work, like you said, trial and error for these teams today, and great work, everybody. And thank you, Sarah, for facilitating and leading with such wonderful questions too, and getting really great conversation going.
Thank you, Michelle, for hosting us and keeping us straight.
Well, great to see all this wonderful work. Well, again, thank you all so much. As we had mentioned at the beginning, you'll be able to watch these in full. We'll have an archival version of this entire series of events in the next week or so. And also for your friends and family who would like to watch, we'll also have this on Facebook Live as well, so you can watch after the fact. Great job, everybody.